Over 65, 4 nuts you must eat, and 4 you should never touch. What I'm about to share with you could completely change your perspective on consuming nuts after age 65. Recent scientific studies have revealed alarming data. Some types of nuts, seemingly harmless and considered healthy, could dramatically increase cardiovascular risks in seniors. We're talking about an increase of up to 48%. This discovery emerges from in-depth research published in the prestigious journal of the American College of Cardiology, which monitored thousands of people for several years. The results are shocking and contradict many popular beliefs about nuts. The reality is that many of the nut varieties we commonly find in our pantries can hide dangerous pitfalls. These foods, often consumed without a second thought, could cause high blood pressure, systemic inflammatory processes, vascular blockages, and even accelerate the deterioration of mental abilities. There is one particular variety, whose name we will reveal during the course of this video, that contains high concentrations of potentially toxic substances. Regular consumption of this nut can seriously compromise liver, kidney, and brain function. You probably already have this type of nut in your cupboard, perhaps considering it a healthy option for those following low-carb diets, unaware of the potential permanent damage it could cause as you age. But don't worry. Today, we will provide you with a comprehensive and scientifically accurate guide to the world of nuts. You'll discover which varieties are truly beneficial for the cardiovascular and neurological systems, and especially which ones you should absolutely eliminate from your daily diet. Stay with us until the end, because we will reveal a disturbing truth about one of the most dangerous varieties, a secret that few talk about openly and that could cause irreversible damage to your health without you realizing it. The 4 recommended varieties for those over 65 almonds. Natural support for bones and energy. Let's begin our exploratory journey with almonds, authentic nutritional treasures for an aging body. These oily fruits represent an exceptional source of calcium and vitamin E, 2 fundamental elements for preserving skeletal strength in the mature years. As we age, our skeletal system inevitably becomes more vulnerable. Fractures, which in youth might be considered minor inconveniences, can become serious and lasting medical complications in seniors. Bone structure naturally tends to become more porous and fragile, a process that accelerates significantly after age 65. A daily serving of almonds, we're talking about roughly a quarter cup, can provide approximately 97 milligrams of calcium, effectively contributing to slowing the bone demineralization process. But what makes almonds truly unique in the nut landscape is the significant presence of magnesium, a mineral often deficient in seniors. Magnesium plays a crucial role as a biological facilitator. It prevents calcium from depositing inappropriately in the arteries and directs it to its correct destination, namely bone tissue. This mechanism is fundamental for maintaining cardiovascular health while strengthening skeletal structure. The monounsaturated fats present in almonds offer an additional benefit for the circulatory system, contributing to the reduction of LDL cholesterol levels, commonly known as bad cholesterol. This characteristic takes on particular importance considering that cardiovascular risks tend to increase proportionally with age. My recommendation for seniors is to consume 15 to 20 almonds daily, preferably raw or roasted without added salt. This regular intake can also help combat constipation, a problem that affects about 40% of the elderly population, thanks to the high fiber content, about 3.5 grams per serving. Research conducted by Tufts University has shown that almonds possess neuroprotective properties, helping to prevent oxidative damage to brain cells, one of the main concerns related to aging. It's important to choose almonds with the skin intact, as this contains flavonoids that, in synergy with vitamin E, considerably amplify antioxidant power. Important note: if you have difficulty swallowing, chew almonds thoroughly before swallowing to avoid choking risks. Before continuing with the other beneficial varieties, I ask you to support this channel by subscribing and activating the notification bell. This helps us enormously to continue providing you with quality content like this. Walnuts, fuel for brain function. It's no coincidence that walnuts have a shape so reminiscent of the human brain. This oily fruit indeed represents one of the most beneficial foods for neurological health in seniors. Walnuts stand out for being the richest source of alpha-linolenic acid among all commonly available nuts. This plant-based omega-3 fatty acid plays a crucial role in the neurological well-being of seniors, supporting neurotransmission processes and maintaining the integrity of neural cell membranes. Recent research published in the Journal of Nutrition documented significant improvements in cognitive processing speed and mental flexibility in seniors who consume just 40 grams of walnuts daily for a period of 8 weeks. These results are particularly encouraging for those who fear age-related cognitive decline. The polyphenolic compounds characteristic of walnuts demonstrate extraordinary neuroprotective capabilities, being able to cross the blood-brain barrier and directly combat inflammatory processes in nerve tissues. This property can contribute to the prevention of neurodegenerative diseases such as Alzheimer's and other forms of dementia. A little-known aspect of walnuts is the natural presence of melatonin, a hormone whose levels tend to decrease with aging, causing sleep disorders in many seniors. Some individuals have reported improvements in nighttime sleep quality by consuming a handful of walnuts before bedtime. The synergistic combination of arginine, an amino acid that promotes vascular function, and antioxidant polyphenols makes walnuts exceptionally beneficial for cardiovascular health as well. They can even enhance the effectiveness of antihypertensive medications, helping to maintain arterial elasticity in seniors. To optimize benefits, store walnuts in the refrigerator to prevent rancidity of their delicate oils and aim to consume 7 to 9 halves daily. An additional advantage: manually shelling walnuts can help maintain fine motor skills in the hands. Don't be discouraged by the naturally slightly bitter taste of walnuts. That bitter note is precisely the indicator of the presence of powerful antioxidants that make them so beneficial. Pistachios, natural allies against hypertension. In the landscape of beneficial nuts for seniors, pistachios deserve special mention, particularly regarding blood pressure control. These small green fruits are often undervalued, but their properties make them an ideal snack for those over 65. Pistachios have an optimal mineral composition, low sodium content, and high potassium concentration, about 285 milligrams per serving. This balance is particularly valuable for seniors as it helps prevent water retention that often accompanies kidney aging. The hypotensive effect of pistachios can reduce systolic pressure by 3 to 5 points, results comparable to those obtained with some prescribed medications, but without unwanted side effects. This natural benefit is particularly important considering the high prevalence of hypertension in the elderly population. The presence of lutein and zeaxanthin in pistachios deserves particular attention. These carotenoids concentrate in the eye's macula, offering protection against age-related macular degeneration, the leading cause of vision loss in those over 60. From a practical standpoint, pistachios present unique advantages for seniors. Their consistency makes them safe even for those with dental problems, unlike other harder nut varieties that could damage fragile teeth or dentures. The natural pigments that give pistachios their characteristic green and purple hues are not just aesthetically pleasing, but function as powerful antioxidants that neutralize free radicals responsible for accelerating aging processes. An interesting psychological aspect of pistachios is represented by the shelling process. This naturally slows consumption, promoting more mindful eating and preventing overeating. The International Journal of Obesity has documented how visible empty shells serve as a visual reminder of consumption, helping seniors better control portions. For those suffering from arthritis in their hands, it's possible to select pistachios that are already partially open to facilitate consumption. The goal is to consume about 49 pistachios per day, equivalent to about 28 grams, preferably unsalted or lightly salted. For the 25% of Americans over 65 who live with diabetes or prediabetes, the 3 grams of fiber per ounce contained in pistachios represent valuable help for blood sugar regulation. Brazil. Nuts, the natural remedy for the thyroid. At the top of our ranking, we find Brazil nuts, which we have selected for their unique ability to support thyroid function, an often overlooked but crucial aspect for healthy aging. With 96 micrograms of selenium, equivalent to 137% of daily needs, contained in a single nut, these fruits represent the most concentrated food source of selenium known worldwide. This characteristic is of fundamental importance considering that thyroid disorders affect up to 20% of people over 65, often undiagnosed because symptoms are mistakenly attributed to the normal aging process. The selenium present in Brazil nuts is essential for thyroid hormone activation, which in turn regulates energy production, metabolism, and mood balance. A particularly interesting aspect is that the selenium in these nuts is organically bound, making it more bioavailable than synthetic supplements. Beyond thyroid support, the specific fatty acids in Brazil nuts contribute to preserving myelin, the protective sheath that covers nerve fibers and tends to deteriorate with age. Maintaining myelin integrity allows seniors to preserve sharp reflexes, quick reaction times, and high cognitive processing speeds. The nutritional power of Brazil nuts is such that minimal quantities are enough to obtain significant benefits. Their rich and creamy consistency makes even a small portion enjoyable. However, precisely because of their selenium concentration, I recommend that seniors not exceed 1 to 2 Brazil nuts per day, as excess selenium can have counterproductive effects. When purchasing, prefer Brazil nuts still in the shell, as this natural casing better preserves nutrients over time. Due to their high fat content, it's important to store them in the refrigerator to prevent deterioration. Brazil nuts offer additional benefits for digestive health, thanks to the combination of fiber and natural oils that promote intestinal regularity, a non-negligible advantage for seniors who often suffer from constipation. Many elderly people find comfort in less nutritious snacks, but Brazil nuts represent an excellent alternative thanks to their naturally sweet and buttery flavor. Emerging research suggests that some antioxidants present in Brazil nuts might positively influence telomere length, the protective caps of chromosomes that naturally shorten with age, potentially slowing cellular aging processes. The 4 varieties to avoid after 65. Peanuts, a hidden inflammatory risk. It's important to immediately clarify a common misunderstanding. Peanuts are not technically nuts, but legumes that grow underground. This characteristic makes them particularly susceptible to mold contamination and the production of aflatoxins, natural mycotoxins that can damage the liver and increase cancer risk if consumed regularly. As we age, our body's detoxification systems become progressively less efficient, significantly amplifying these risks. Peanuts also contain proteins that can trigger inflammatory responses in many individuals, even in the absence of overt allergies. Seniors are already naturally more exposed to joint pain, cardiovascular stress, and cognitive decline. The chronic low-grade inflammation induced by peanuts can exacerbate all these problems. The lipid composition of peanuts, rich in omega-6 fatty acids, further contributes to inflammatory imbalance, considering that most Westerners already consume excessive amounts of omega-6 compared to anti-inflammatory omega-3s. An aspect often overlooked by doctors is the potentially dangerous interaction between peanuts and anticoagulant medications, like warfarin, due to vitamin K content. This interaction can alter the effectiveness of anticoagulant therapy with potentially serious consequences. Commercial peanut products worsen the situation further with the addition of hydrogenated oils, sodium, and sugars, elements particularly harmful to the cardiovascular system of seniors. Even natural peanut butter can contribute to hypertension, a problem that already affects 63% of elderly Americans. Improper storage of peanuts can lead to rancidity and the formation of dangerous free radicals. The industrial practice of roasting also produces acrylamide, a chemical with potential neurotoxic effects, particularly concerning for those already worried about memory loss. Even if you've consumed peanuts for years without obvious side effects, replacing them with our recommended varieties, even just 3 days a week, can significantly reduce exposure to these harmful substances. Cashews, the glycemic deception. Cashews represent a particular risk for seniors due to their high glycemic impact and unusually high carbohydrate content for nuts. With about 9 grams of carbohydrates per ounce and low protective fiber content, they cause a glycemic response that can be problematic for the many seniors with blood sugar control issues. Considering that about 25% of those over 65 suffer from diabetes and an additional 48% from prediabetes, this characteristic of cashews should not be underestimated. The problem is aggravated by the positive perception many have of these fruits, leading to excessive consumption without considering the impact on blood sugar levels. The smooth and curved shape of cashews also presents a non-negligible choking risk, especially for people with swallowing difficulties. They are among the types of nuts most frequently associated with aspiration episodes in seniors. From a nutritional standpoint, cashews contain high amounts of oxalates, compounds that can bind to calcium in the intestine and reduce its absorption, a serious problem for seniors already at risk of osteoporosis. The same oxalates increase the risk of kidney stone formation, a danger that intensifies after age 60. The processing of cashews represents a further problem. To remove toxic urushiol, the same substance present in poison ivy, cashews undergo intensive treatments that significantly reduce their nutritional value. Many commercial varieties are also roasted in harmful oils and excessively salted. Cashews also contain enzyme inhibitors that can interfere with protein digestion, problematic for seniors who often already have digestive and protein absorption difficulties. Their creamy consistency facilitates excessive consumption, potentially contributing to weight gain at a life stage when maintaining a healthy weight becomes increasingly challenging. Macadamia nuts. The caloric danger. Despite their delicious flavor, macadamia nuts represent one of the most significant nutritional risks for seniors due to their extreme caloric density. With about 200 calories per 30 grams, they are the most caloric nut variety available, a serious problem considering that basal metabolism inevitably decreases with age. The extraordinarily high fat content, about 22 grams per ounce, can overload gallbladder function, already compromised by age. This can trigger painful episodes in 15% of seniors who have asymptomatic gallstones. Macadamia nuts also contain among the highest levels of saturated fat in nuts, about 3 grams per ounce, which can contribute to increased LDL cholesterol, already a common concern among seniors. Their hardness and density represent a serious threat to the oral health of seniors with implants, crowns, or weakened teeth. This is particularly problematic after age 65 when tooth enamel thins due to wear and reduced calcium absorption. From an economic standpoint, macadamia nuts are among the most expensive, which could push budget-conscious seniors toward cheaper and potentially deteriorated varieties, exposing them to even more dangerous oxidized lipids. Commercial versions further worsen the nutritional profile with the addition of harmful oils and excessive sodium through roasting and salting. Their rich and inviting flavor can easily lead to overconsumption, especially in seniors who might have less sensitive taste buds and prefer more intense flavors. Ironically, many seniors consume macadamia nuts believing they're doing good for their heart, but research on the cardiovascular benefits of nuts has focused primarily on less fatty varieties. Pistachios offer a much superior nutritional profile for seniors' needs. Pine nuts. The risk of drug interactions. Pine nuts represent the most problematic category for seniors, primarily due to their drug interactions. They contain compounds that can interact with over 60% of medications commonly prescribed to those over 65, altering their effectiveness or causing dangerous side effects. This interaction is particularly concerning with statins, some antidepressants, and antihypertensive medications, drug classes frequently prescribed to seniors. Most doctors and pharmacists never inform patients of these food-drug interaction risks, creating a dangerous information gap. Pine mouth syndrome represents perhaps the most disturbing problem associated with pine nut consumption. This condition causes a persistent bitter and metallic taste that can last weeks, dramatically affecting appetite and nutritional status. Research indicates that up to 42% of affected people experience significant weight loss. This syndrome seems to affect seniors more frequently, probably due to changes in taste receptors and detoxification pathways that accompany aging. Taste alteration can have devastating consequences on nutrition in seniors already at risk of malnutrition. Pine nuts contain high amounts of polyunsaturated fats that oxidize rapidly, producing inflammatory compounds. This can be problematic for seniors already living with inflammatory conditions like arthritis. The small size and oily consistency of pine nuts make them an aspiration risk, particularly concerning for seniors with swallowing difficulties or who take medications that cause dry mouth, a problem affecting over 70% of seniors on multiple medications. The enzyme inhibitors present in pine nuts can hinder protein digestion precisely when the body's natural protein absorption capacity is already decreasing with age. Their high caloric content, often masked by their use in preparations like pesto, can contribute to weight management problems common after age 65. Emerging research suggests that some compounds present in certain varieties of pine nuts might accelerate age-related macular degeneration, the leading cause of vision loss in seniors. Conclusions. The choice of appropriate nuts can profoundly influence health, vitality, and cognitive functions during the mature years. The dietary decisions you make today regarding which nuts to include or exclude from your diet can have lasting impacts on your future well-being. Remember that the consistent application of small changes produces extraordinary results in the long term. Your health deserves these small but significant adjustments in food choices. Now, it's your turn to make your voice heard. Have you noticed improvements in your health after modifying your consumption of certain types of nuts? Which variety has had the most positive impact on your life? Share your experiences and reflections in the comments. Your contribution is valuable to the entire community. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.